Good morning. Today we are speaking with UMHS graduate Dr. Mwamba Malekani. And Dr. Malekani, I want to welcome you today and thank you for your time. Can you please just tell us what you're doing now and also about your upcoming psychiatry fellowship at Cincinnati Children's?
Yeah, thank you for having me. I am a third year resident in Detroit, Michigan at Authority Health GME Consortium. We're affiliated with Michigan State University. I'm planning to fast track now into child and adolescent psychiatry, meaning I'm leaving general psychiatry residency a year early to start my fellowship training.
Okay, great. And can you just tell us a little bit about how you became interested in pediatric psychiatry and what are some of your goals for your upcoming position in Cincinnati?
Sure. So I became interested in child and adolescent psychiatry after graduating from medical school. I worked at a residential unit that had a population of young girls from 13 to age 17. And then another part of the unit also had young adult women. But that experience I had in particular after medical school, where I was exposed to child and adolescent psychiatry, really solidified why I wanted to go into psychiatry first, but then in addition, wanting to work with that particular population.
Great. And do you have any particular goals for your upcoming position at Cincinnati Children's?
So, a big reason why I chose Cincinnati Children's is because they have a lot of resources in terms of development. So, I'll see very young patients around 2, 3 years old who have developmental disorders, all the way to older young adults who are sort of graduating or aging out of the pediatric population. They also have strong eating disorder training, which was something that I observed was not necessarily offered everywhere. So I will be able to learn more about eating disorders. I'm particularly interested in that because I think eating disorders are something that's sometimes overlooked in minority populations because the presentation may be different because of cultural aspects. And then finally, Cincinnati Children's has neuromodulation. And I think that's a big way that psychiatry is kind of moving forward. We're trying to do more targeted therapies. We've had ECT for a very long time, but we're doing more targeted therapies like TMS, ketamine, and moving away from um, medications that have a lot of side effect profiles.
Okay, great. And would you say is the career path for a pediatric or child psychiatrist? Do you have any advice for current and prospective students out there that might be considering going into child psychiatry?
Sure. I would say if you have any inkling or interest, I would say join the national chapter. So, the American Academy of Child and Adolescent Psychiatry has a whole division for medical students and residents. They have Zoom calls once a month. They offer scholarships to attend the annual meeting. They have a mentorship program. So I got involved in ACAP and really found some great mentors there. I would also say do pediatric rotations and as many psychiatry rotations as you can when you're in medical school, because child psychiatry is not exactly the same as psychiatry for adults. So it's important to see how your interviewing skills are adjusted and how you're working more with parents and schools as well too. And finally, I would say, in residency, try to get as much exposure as you can. So I was able to do an inpatient pediatrics rotation as a resident my intern year, and I was also able to do 4 months of inpatient child psychiatry as a resident too. So that really solidified my interest.
Right. Okay. And finally, how did UMHS as a med school help you become the doctor that you are today?
I think a lot of aspects. I think UMHS was one of the places where I really learned that it's okay to ask for help. I found that on the island and through rotations, there are professors that really cared about our learning and mentors that I made. I also found that just with my colleagues, my peers, I have lifelong friends from UMHS, and I really accredit my story and my journey to UMHS.
Okay, great. And is there anything else that you'd like to add about child psychiatry or UMHS or just, medicine in general for people out there? that we haven't covered?
Child psychiatry is a growing field, and we have a physician shortage. So if you have any interest in child psychiatry, definitely look into it. It is worth the return on longer training, but it is worth it and it's a rewarding field.
Absolutely. I think that's sound advice. All right. Well, Dr. Malekani, I want to thank you so much for your time, and I wish you all the best in your upcoming position at Cincinnati Children's. Okay.
Thank you.